Hey guys, we are back with another upper body injury, and today we're going to be focusing on the elbow, medial and lateral. You've heard of tennis elbow, golfer's elbow. We're going to focus on both. They're pretty similar in the way we treat them. So with the EPAT machine, you want to think we start with vibration, just like we have with all of our other injuries, and then we move on to the actual acoustic pressure. Because it's a much bonier area with usually a little bit less muscle tissue, we tend to use smaller heads, and we tend to grade it up nice and slowly to make sure you're comfortable. We're not hitting any of those bony areas. There's also some nerves in there, so we just ask for feedback as we're working on you. When we're working in the medial elbow, we tend to hit a lot more bicep and the inside of that forearm, and then when we're working on the lateral elbow, we hit a little bit more tricep down into that forearm. Those are areas that tend to be hot spots. Then obviously we work into that pain point for the second part as we're more focused. In addition to exercise, this can be super, super useful for getting some of that super sticky pain out of those elbows that tends to hang around for a long time for a lot of our athletes. And hopefully we'll see you soon so you can try it out. We are back with the exercises for elbow tendonitis in addition to the EPAT. And the first one we're gonna start with is basically a dumbbell rotation. So you're gonna pick up a dumbbell. We usually start people with 2 to 3 pounds, less than 5 pounds usually. And you want to set up so your forearm's nice and flat on a surface. You're kind of at a very comfortable angle so your shoulder's not getting moved any crazy directions, and you're going to hold it right at the bottom of that bell. All you're going to do is you're going to move it so your forearm rotates one way, come back, and then your forearm rotates the other way. If you're having more lateral, medial, epicondylitis, we want to make sure that you're just taking your time with that direction. Most likely you're going to be more irritated one way. For the second one, it's going to be a little bit heavier weight, a little bit more intensive. So it's going to be a farmer's carry. All you're going to do is you're going to pick up a kettlebell. Think heavier better, as long as you can really tolerate the grip and it's really activating that forearm, and you can keep nice and tall. You want to think about gripping nice and tight, keeping a steady walking pace so that you have a long-term activation of those muscles that are going to feed into that elbow. It's also a really great core exercise if anyone's ever looking for that, and good luck with these ones.